Woo. Woo. Live.
Hello, hello, hello.
All right, ladies, let's see.
Okay.
Well, first off, we would like to say welcome to our survivors health equity panel. We want you all that are viewing, if you don't mind, if you have any questions or comments that you would like to say, please feel free to drop them in the chat. We have some great panelists here today. We have Karen North. She'll be representing the LGBTQIA community. We have Claudia Perez, who will be representing the Spanish speaking and his Hispanic communities. We have Lindsay, who is from North Carolina, who will be representing for African American and Black women. And we also have Juliana, who will be representing our rural communities. So, first, I would just like to say thank you so much, ladies. And we have Jocelyn as well, who will be helping us moderate the communication and the comments. So, ladies, are you
Yes.
ready?
We are
Ready.
ready.
Well,
Yeah.
then, yes.
Great,
All
great.
right.
And my name is Kiera Long. I will be your moderator on tonight. I am with the American Cancer Society's National Roundtable on Cervical Cancer and HPV vaccination. So thank you for having me. So we're going to kick it off. And our first question will be going to Karen. So, Karen, um, we would like to know um, how can healthcare providers and organizations better support the LGBTQIA plus community, cervical cancer survivors, in navigating healthcare systems, addressing their unique healthcare needs, and eliminating barriers to care, including discrimination or bias?
One of the big things is to increase the ability to self sample. Multiple people with a cervix that don't identify as female find it very uncomfortable to go to a gynecologist or are very discriminated against. That is a big part. Also, learning that not everyone that has a cervix identifies as a woman, and also changing the registration forms, making sure that it's more open based, more gender inclusive.
That is right. So, one of the things that I missed before we started was giving you the definition of health equity. So, health equity is making sure that everyone has the same access to care, regardless of race, religion, gender identity, or where they live. So, we just want to make sure that everyone has equitable care to cervical cancer screenings and treatment to make sure that we live in a world where people can not only survive cervical cancer, but where we can prevent cervical cancer as well. So, with the second question, this is going to go towards Lindsay. So, Lindsay, what initiatives or policies can be implemented to improve cervical cancer screenings and prevention outreach to Black women?
Hi, Kiara. So in our community, anything below the belt is talked about very rarely. So it's kind of quiet. It's kept. Everything is private. In regards to anything below the belt. So just to have an open conversation, and also as far as providers go, they need to change the way they're presenting it to us, because it's not being presented as something that we need, and it's not being presented as cancer preventative. It's being presented as optional. And it's definitely something the language needs to change in regards to how we receive the information.
Great, great. So when you say below the belt, you're meaning any body parts below the belt, correct?
Yes, ma'am. You know, we even in our household, we don't talk about anything. We don't talk about our cervix or our vagina. We're just told that it's private area and no one is supposed to touch it, and everything is quiet in regards to that. So we just need to have open conversations in our communities, in our homes. That's in our communities. We definitely need to be open, more open about it.
That's right. Thank you so much, Lindsay, for your response. So up next, we have Juliana. So Juliana, this question is for you regarding rural communities. So it says, what strategies or tools can be used to enhance the availability of cervical cancer screening options to women located in rural communities?
So, piggybacking off of what Karen said, there is a big issue with the lack of providers or access to care in rural communities. So, like Karen said, having access to home testing kits, I believe, would be a huge impact on screenings. And then we also have a good friend of ours to the community, Linda Hayes, who's working in Alabama on mobile screening units. So, having mobile units to people who are so far away from healthcare would be amazing.
Yes, it's always important to ensure that we can reach people right where they are, whether that's having implementing after hour clinics or, like you said, having mobile units.
Mm-hmm.
So yeah, Lindsay, that's awesome. Do you know of any initiatives or anything like that? Have you heard of anything um, that pertaining to meeting people where they are,
For me,
Juliana?
yes. So, like I mentioned, Linda Hayes earlier. That's okay.
Okay.
um, she is a friend of Survivor, and she works for the Alabama Department of Public Health cervical and breast screening program. And she is working on a big program all throughout the state of Alabama for cervical screening clinics and mobile units like that. It's not so much happening in Georgia, but we're going to change that.
Well, we have to start somewhere, right? And that's always great to hear
Yes.
about great initiatives going on in in communities. So let's see, Claudia, for Latino women, how can healthcare providers and organizations create a safe place for Latina survivors, Latinx survivors, to ensure equitable access to cervical cancer care?
For Latin women, I think the worst the thing who prevent to get an screening is most about the stigma. It's the fear, like Lindsay mentioned it. We also don't talk about anything below the belt. We were taught to don't talk about it. And another thing is we are scared sometimes from the language barrier. For me, is to have more access to Spanish to sorry content in Spanish, to be the medical who is able to translate for the people who is training in the medical field, who can talk our language, people who can we can feel comfortable talking to, because the big stigma, the big fear we have about the stigma is what prevent to go and get the screen. Or you don't go and ask to a friend, if like my friends, they're not gonna ask me what's going on with me, because supposedly we don't talk. Although I'm very open with what happened to me. I think is why we need more people training on Spanish, more material in Spanish, or more translators.
Mhm. Thank you, Claudia. So I will say this, because this seems like to be kind of a running thing that we have so far. So this kind of goes off script. So I would like to hear from each one of you. How have you worked to in the stigma, whether it be, you know, within your family, or, you know, your church, or what have you done to people who that you reach? What have you done to end the stigma and be able to talk about things below the belt? And Karen, I'll throw that back at you first, if that's all right.
So I agree with Claudia. We need to have medical interpreters and access to those that can explain things. But to help end the stigma in the sexual gender minority, LGBTQIA, one of the things that I did is I held a Survivor fundraiser at Hamburger Mary's, a drag bar in Kansas City. And people, it started conversation. People came up, asked what HPV was, asked how could they get screened. But going into those communities and just networking within those communities and sharing your story.
Great. Thank you, Karen. So, Lindsay, how have you helped to end stigma within your family or your community to bring more awareness about cervical cancer?
So in my community, I not only joined the Chamber of Commerce here just for networking purposes as well. I needed people to know that I was a survivor and everything that I did or didn't know beforehand. Just me telling my story, talking to them as if we're just girlfriends having a conversation, not talking at them and not trying to put too many medical terms on them to make them feel lower or feel as if they don't know what's going on, so that they can understand exactly what's going on, to show them a face and put a face to it. Because sometimes just because you see it or you see a bunch of facts or a bunch of statistics, people don't really pay attention until they see someone going through it, somebody that looks like them that's going through it, somebody that has gone through it and is here to tell the story. So that's a big reason why I tell my story as much as I do, and any chance I get, I tell it. And also through my health fair, I decided to do one because there was no information. There was a whole community aspect here where I live that I didn't know about until after I finished all my treatments. All my treatments were an hour away from me, and I should have known to been able to do it right here where I live. So I wanted to change that.
Yeah. Juliana, what about you? What have you done to end stigma in your rural community?
Yeah, so being in the South, kind of like what Leslie said earlier, it's not talked about. You don't talk about women's health and gynecological issues. So I started talking about it. I started getting loud about it, talking about it on Facebook. I've done a couple of newspaper interviews locally, and I was able to get Georgia's governor to proclaim September last year as GYN Cancer Awareness Month. So starting that conversation is a big deal.
Great. That's
Kira,
awesome.
Kira, I also think, I'm sorry to bother you, but
Yeah.
I also think it's, a chat came up that it's also language barriers, right? I think we need to
Mhm.
tell our story in our language. I think that's a huge thing. Our stories matter, and I think telling it in our stories, especially those who are in Spanish speaking or in Chinese, or for me, for Thai, it's very much our language barrier that we really need to overcome and tell it in our language.
Yes, and I will say too, that is one thing I haven't heard yet. Oh, we lost Lindsay. One thing that I haven't heard yet was um even like talking about Survivor, like this platform that has been created. I mean, this is just awesome, you know, like just being able to hear the stories. And like someone said, I know, oh yes, Carla said our stories and faces make it real. It does, it makes it real. And just by sharing your story, I mean, it's changing people's lives. So what you're doing, sharing your story, however you share it with whomever you share it with, just know like any small change is change and it's making a difference. So I definitely am very appreciative of all of you ladies who have been a part of Survivor and being able to be brave and share your stories. So I do appreciate that. Claudia, how have you shared your story? I'm sure you shared it in your native language. How have you shared your story to end stigma?
I have shared my story after I get out of the hospital. After my surgery, I put it in my Facebook what's going on. I didn't want to put nothing, but when I thought, I say, if someone of the people on my social media or my friends go and get checked, for me is a gain. I always trying to bring Survivor, to bring the cervical cancer, to go and check the HPV vaccination too with my friends. Some of my friends were afraid to get their kids vaccinated, and I told them, until you get it, you don't understand. And you don't want your daughters going through, although my cancer was pre-cancer, you don't want your daughters going through that. And is what I'm doing. I always post in Spanish, try to translate to English for the people I have doesn't speak Spanish, and also for me was going to Survivor school and learn, and to, how do you say, to pass over my fear of public speaking in English. And Survivor school, I told my story in Spanish. I asked to do that because for me, it's more easy to reach to my people in my own language. But it's one of the things I'm doing. Like be here for me, sometimes it's hard, but it's something that I promise I will do. And because I don't want more women going through this. And I know the statistics in Hispanic women where I live is really high, and I want to change this. And I want people realize that it's not his fault if they get HPV, if they get cervical cancer. It's not their fault. It's not because something you do bad you did or are doing. It's not for because of that.
Yes, that's great, Claudia. Thank you so much. I know that that's one big thing that I know we're doing with the national roundtables is trying to make sure that we can change the narrative of how cervical cancer and HPV is thought. It's not your fault. We want to make sure that people know that HPV vaccination is cancer prevention and not necessarily regarding sexual connotation. So that is very important, and I would encourage all of you to continue to share your stories like you're doing today, whether it be in a large group like this or just having a one-on-one conversation with someone. I also would like to encourage our viewers to continue to fill up the chat. We're loving the encouragement. I guess I'm speaking on everybody else, right? You ladies, you're enjoying the encouragement in the chat. Can you see it? So if you have any questions or anything that you would like to ask the ladies, please be sure to drop it in the chat, and we will answer them for you the best we can. All right. Let's see. All right. So did I ask? I can't remember. Okay, here we go. So this one is a round robin question, pretty much for everyone. And we kind of already went over this, but if you have anything else to add, please feel free to just come off mute. I'm not going to call on anyone. So how can we address the unique needs and challenges of individuals from each of your communities? So from the LGBTQIA plus community, the Black community, the Latinx community, and rural communities. What can we do to ensure that whatever challenges and needs that the individuals from those communities have, how can we ensure that they get the care that they deserve?
I'll start off. And first off is quality. So many providers are educated.
Are you having trouble hearing Karen? Yep, so there's some trouble.
Okay, is it better?
It's a little bit of feedback. I'm not sure what's going on. Now you're on mute. Now you're muted.
There we go. I took my earbud out. Is that better
Okay,
though?
there we go. You sound so much clearer.
Access to healthcare, whether it be anywhere in the world, educated providers so that they know the reason why, the risks, and not being afraid to talk to people and parents. And again, prevention is starting with vaccination, and it's not about sex.
Great point, Karen. Anybody else like to go?
I think for AAPI, it's just access to care and language. There's a huge language barrier, and I think with AAPI, we group our whole Asian Pacific Islander community together.
Mm-hmm.
And we have Chinese, Japanese, Korean, Thai for myself, and a whole host of other um, cultures that are grouped together. And it's very difficult when you have a language barrier and also just access to care, as Karen said. I think we really need to be able to explain the access to care and be able to explain to people that you have certain screenings, you have rights through your insurance, and you're able to access that freely through your insurance. That's the hardest part, I think, for a lot of our generation or a lot of our cultures, is just to be able to explain that, through your insurance, you have rights and access to care, and through that you're able to access that. So I think that's the hardest part, especially for the API, because I think for API we group everyone together, and without explaining that, without providing them the statistics for their cultures and the statistics for the language, is very difficult.
Yes, I feel like I know statistically speaking, it's so much easier to group people together because there's this narrative of that there's not enough, like the numbers aren't large enough. But I feel like no matter how small the number is, for statistics purpose, that's still someone's life, though no number is too small to be recognized. So I feel like that is very important. Jocelyn, thank you so much for sharing that. Go ahead, Claudia, if you had something.
Okay. I think on my community is access to healthcare. Uh, doesn't matter if your immigration status. That is sort of another barrier for many people. They don't have. They are afraid to go and ask for help because they are afraid. Um, they, if will something happen because of their immigration status, or they are afraid to go, or because they don't understand that they have rights to get that healthcare. Also, for me, is education and getting involved, educating our communities that this our women's our disease is no is sorry about is like it is preventable. It's preventable if you get the help on time.
Yep. Thank you so much, Claudia. So it is very important to make sure that people have access to care and be able to get screened. There's I guess you could say everything's done as soon as possible. There's not a lag from screening to diagnosis to treatment. So yes, Claudia, that is very important. Lindsay or Juliana, would you like to go next? Whoever like to go next.
Yeah, I was gonna say, as far as our community, just not being heard, that can put somebody off. If it took 5 doctors for me to get my diagnosis. If I was anybody else, and after the first time going to the hospital and being told that what I was experiencing was normal. If somebody in that world, a doctor, an expert, somebody that's supposed to know what they're doing is telling you that what you're experiencing is normal, some people will be put off and just say, okay, they said it's normal, so maybe it's in my head, and they start to second guess what's going on in their body, even though they know that something is wrong. And they might feel like, if you telling me that something is wrong, then I don't need to come back, because that's what you're telling me. You're telling me what I'm experiencing is normal. For me, I had to keep advocating and keep saying, no, this is not normal for me, because the amount of bleeding that I was experiencing couldn't possibly be normal. And I wasn't going to stop until I got the answer that I needed, because it wasn't normal. So just for them to be heard, for us to be heard, is huge, because we already don't want to go to the doctor anyway. I don't know anybody that is excited about going to the doctor. So when you go, you need to be heard, and you need to have people feel like they're going to pay attention to what you're saying and take a deeper look than to just write you off and tell you that when you're experiencing something, oh, I'm just going to write you a prescription and write you off, basically.
Yeah, Lindsay, that you're right. That is very important. Just being able to know when you know something is wrong, being able to advocate for yourself. So that takes a lot of courage, because a lot of people, they don't know, they're not sure what to do. So you being able to make sure that you get the answers for yourself shows your strength. All right, Juliana. Oh, she's
Am I
frozen, I
frozen?
believe. I think so.
Okay, can you
There you
see me
go.
now?
Yep.
Okay. So, a big part of my story was I lived in a very rural town of about 26,000 people at the time I was diagnosed. So, having a lack of access to providers is a very big issue. So, I think starting virtual visits, telemedicine, like a lot of providers did in the pandemic, I think would be a good start. But then we also have a big problem of underinsured or uninsured. So getting some of these programs that have doctors, that work within certain hospitals or whatever for these mobile screening units, and then the at-home testing kits. I think that's a good start, because we do have, such a lack of access to any healthcare.
Yeah. I think that's a great start. So I do appreciate all of you ladies and your answers. So I do have a question for you. So how would you encourage someone from your community to get their cervical cancer screening? And just the question I'm gonna throw out there, and you can, whoever wants to answer.
I think it's funny because for my API, they don't know that cervical cancer screening or screening is part of their women's, their well women's checkup, right? And it's funny because when I tell women that that's part of your insurance and it's covered, they're like, oh, really? I didn't know that that was covered. So I think it's important for insurances to be able to say it's part of your free well woman screening checkup, and it's part of your insurance that you don't have to pay out of pocket for if you're, depending on your insurance, right? I think that's an important thing to be able to define for women, especially in certain communities, right, that are considering expenses and things like that, socioeconomic issues. So I think it is vital for people to insurances and even employers to say, look, this is part of your well women's checkup. It is free. It is part of your insurance. You should be able to access that. And please go to your doctors and say, I need a well woman's checkup, and this is part of the screening.
See, Jocelyn, I don't know if you saw someone in the chat didn't know that cervical cancer screenings are typically covered by insurance. So you're
Exactly.
speaking knowledge. You're
No, I mean it's
educating.
serious. It's something that no one, a lot of people don't know, and especially when I talk to certain API communities, they're like, "Wait, I don't have to pay for that?" And
Mhm.
it's, I mean, given you have to understand, it's an expense for them, right? Every time they think they go to the doctor, it's an expense, right? It's something they have to pay out of pocket for. But this is something that is part of their coverage, and I think insurances should promote that more and say, "Hey, this is part of your coverage. Please go get checked. It's part of your annual screening, and you should be able to access that free of charge without paying any expense for it." So I think it's vital for insurers' employers to say, "Hey, please feel free to go to your doctor and demand that, or just say, I'm here for my well women's screening checkup." And that's included in that.
Mhm. Yep. Let's see. They were dropping in the chat how they help other people get their cervical cancer screening. So it looks like Larissa says that she does it by sharing her story. We have someone saying that they share information on social media, which is the pretty much the way that we get all our news and information now, right? So social media is always great. So going back to you ladies, how do you encourage someone to get their cervical cancer screening?
I was gonna say, Jocelyn, yeah, here too in my community, they had at the women's health clinic, they do the cancer screenings for free, whether if you don't have insurance or not. And again, I was going all the way a whole hour away and didn't know that they were doing it right here in my community. So that was information I found out afterwards. And I agree with you. I feel like, why didn't I know that the entire time? Why did I have to drive a whole hour and a half to get my treatments when I could have been going right here in my own community to get that done? So that's another reason why I had that information as well at the health fair, because people need to know that, and they do need to be talking about that it's right here where you are. You don't have to travel outside of where you live in order to get screened. And I also tell people, now, hey, I'll go with you to the doctor, or hey, call me while you're at your doctor. If you don't know what to ask the doctor, or you don't know what questions to ask, have me on speaker or have me on the phone, and I'll ask them for you if you're scared to ask. Anything that you need to do, because we can't be private about it anymore. We can't be, even during this weekend when I had the interview at the radio station, and he told me, this conversation is making me a little uncomfortable. And I said, well, you have to get uncomfortable, because we need to have these uncomfortable conversations. So, I'm sorry that you're uncomfortable about hearing about that, but that's exactly why we need to be talking about it.
You're right, Lindsay. You do have to get comfortable with being uncomfortable. So that's the key. That's the start of talking about cervical cancer. Let's see. I was looking to see in the chat if someone had some things to say. It looks like it says no more secrets in 2024. Hey, I like that. I like that. So let's see who else would like to go and let us know how they help get people screened for cervical cancer.
I piggyback off Lindsay again. Being diagnosed at 27 years old, I feel like it's so important for me to just talk about it, share my story. I will look, if I run into you in the grocery store and we're standing in line, I'm going to talk to you about it. I'm going to ask strangers if they're getting their pap smears, because it's so important to me. And like Lindsay said, my local health department here offers free breast and cervical screenings, but nobody knows that. They don't advertise it. If you walk into the health department and you ask about their cervical cancer screening program, they just point to information packets on the wall. So we got to do a better job to talk about it and make sure that, hey, these services are out here. They're free. Take advantage of them.
That's very important.
I'll say one of the other things that I like to do is wear my Survivor swag. When you have Survivor swag, you might be stopped in an airport or on the street. What's Survivor? and it opens doors. Or you're together, hey, would you take a picture of me and my friends? Oh, sure. Are you guys gathering together for something? Yeah, we're all friends, we're all survivors. And again, it opens the door to things. Don't be afraid to speak up. Don't be afraid to ask for a second opinion. And just, yeah, talk, share.
Yeah.
Ye- Hi. As I mentioned it before, I always bring the conversation with my friends. Have you already go to the gynecologist? Go and get checked, please. Vaccinate your kids. Um, Also, this time I was in the hairdresser with my friend. She was dyeing my hair this color, and some people noticed that color and were asking, "Why are you dyeing your hair that color?" And I told them because I'm a cervical cancer survivor and I going to a summit. And this time, like I did this because I want people to notice uh, the color of my hair and asking why I did it to start a conversation to to tell them what it is very important to go and get a screen. And some people sometimes told me, "Oh, but my doctor tell me because my pap smear was okay, I need to wait 3 years." And I say, "No, go and check. I go every year. Although they told me I don't need to go, and I always ask, like Jocelyn mentioned, it's something that my insurance provide." And I did it every year. I have not noticed where I live. They provide breast cancer screenings free, but I didn't hear anything about cervical cancer or pap smears for free. I I have checked, I think, like Planet Parenthood, and I have seen that they charge a little fee for doing that for people who doesn't have insurance, but I haven't seen anything about free screens for the people without insurance. I was in another summit locally with UCSD San Diego, and they told me they're gonna send me the links for the resources for the people in Imperial Valley, and I told them this will be great because here is so many this information for the people. When I was diagnosed, I didn't find anything. I have to find anything by myself. No support group, nothing. And I try always to bring the conversation to educate other people. I don't mind sharing my story to telling them how I how I get it and all.
I mean, Claudia's story is just, I mean, what she said, it just resounds from our community as well, because our community is the same thing. It's funny because you talk to a lot of Asian Pacific Islanders and they're like, what is a cervix? Unless you have a child or you're ready to give birth to a child or you're pregnant, they don't even know what a cervix is. And they're like, wait, so I need to what? And so I think it's vital. I don't think we even talk about the cervix. And that is a huge deal from at least my community, even all communities, to just talk about the importance of what is a cervix and how that benefits I mean, as a female, what does that mean for us? I mean, and that is a big deal. And you talk about, especially, our older, in API, our older communities, our older women who have children and have had children and, probably don't need their cervix anymore or, not privy to them. But I think that's the thing is we need to really talk about our cervix, right? What's important? Why is it important? And, I got diagnosed at 22. I didn't know why I needed my cervix. No one told me what my cervix was. And so, me, I think it's really important to at least talk about the cervix, not just cervical cancer. And I mean, that's vital, but really, why is cervix important and why we need to care about it?
Yeah, that's very true. I feel like when it comes to this, there's really no question is a dumb question. I mean, our your health and your life is at stake. So to me, there's no question too big or too small, or one that one that you feel like you should know the question, the answer to. If you're confused or you don't know, ask and like Claudia said, I know that sometimes when you're the first person to go through something, especially for you ladies, like cervical cancer, it's difficult when you don't know the resources that are around you. But the great part about it is that you can help others now that you've gone through it. Others can you can walk alongside others who have cervical cancer as well, or are going through diagnosis or needing to get screened, and you can be a friend or a sister and build a bond to help those people. So yes, I appreciate all of you ladies and your answers, and you have the chat blowing up. So I'm gonna give you some of the things that are being said. So Anne said that she's seen Karen in action at the airport. So Karen, I don't know, what did you do at the airport, Karen?
Actually, Ann and I were both at the airport, and we had somebody ask, what are we wearing teal and white? What is Survivor? I will also add that my son wears Survivor swag because his buddies and his buddies' girlfriends have asked, what is this? The more we can spread the word through our family and friends, the more there will be no more in 2024.
That's true. It looks like we got some love on the Survivor swag. Who doesn't love swag? So and especially when you can wear it in a nice teal. Let's see, we got some love for Claudia's hair. Claudia, people are loving the hair. Yeah, and we just have some people just saying this conversation has been excellent. Looks like people are talking about just starting the conversation, telling Jocelyn that she is spot on and she has been this whole time. So let's see. I think we have one more question, and then if there's anything in the chat that you guys would like to discuss or like to hear the ladies' opinion on, please drop it in the chat. We want to continue this conversation. So well, maybe there's two more questions. It says, how can partnerships with community organizations and advocates bridge the information gap in your community as far as cervical cancer?
Yeah, so you don't know what you don't know, right? So when you have powerful organizations like Survivor, like the American Cancer Society, and when you can bridge that gap to local health departments or rural hospitals, anything like that, then we can try to end such a breakdown in communication, really.
That's very true. Let's see. And learn, and not only when you find out who's in charge or what information they have, whether it is something national like Survivor or the American Cancer Society or someone local in your community, reach out. I mean, people always like to hear from you and figure out how they can better serve people in their community. So don't be afraid to make those connections with community organizations. Anyone else like to speak to that?
I think, Carrie, you're right. I mean, the connections and just the network, right? It's hard, to be able to share, figure out how to share a story with who. And being a part of Survivor, we're able to be on such a big platform, an international platform, to be able to share our story with others. And I think that's key, to be able to find that, area or platform to be able to share your story and hit the audience that you're looking for. For me, it's, for the API community, and to be able to share that internationally. And Survivor is an international organization that hits that community. I think that's huge.
I'll also add in Talk with your provider. Talk to, for us survivors, talk to our gynecologist, our radiology oncologist, our gynecology oncologist. Let them know about Cervivor. Let them know, hey, I can be your contact person. Or, you know, if you don't feel like or comfortable, or that their patient doesn't feel comfortable, that provider has that information to pass it on to them, because no one should feel alone. They shouldn't feel ashamed.
That's very true. Very true. Thank you for sharing that, Karen. Anyone else like to share how you can partner with a community organization? If not, we have another question. Let's see, Claudia. I'm gonna start with you. Um, so it says, lastly, what's one thing that you want to tell others who are newly diagnosed and going through treatment or entering their survivorship phase?
Uh, I want to tell them that nothing of this is your fault. You are not alone. Uh, Look for support. Look for a group like Survivor. Um, if you find me on Facebook and you feel alone and you want to talk, I'm here for you too.
Thank you. That sense of community is definitely needed. Lindsay,
Yes, ma'am.
I'll repeat the question for you. Let's see. So, what's one thing you would like to tell others who are newly diagnosed, going through treatment, or entering their survivorship phase?
So I do this daily. I tell people not to express all their emotions, like not to hold anything back, to feel everything that they're feeling. Also, don't take anybody else's story. I mean, don't take anybody else's symptoms and everything on. Like, this person did that. So is that what I'm going to go through? Because everybody's situation is different. And sometimes that can consume you listening or watching to what everybody else is going through, because you may not have the same experience. So I always say, um, you know, your situation is your situation, but we're here for you. We're here to help. We're here to guide. If you want to scream, cry, whatever it is, we're here for you. And also, y'all know my favorite one: celebrate all wins, because there's always something positive, and no matter what negative is happening, because there's a lot of negative when you're dealing with what you're dealing with. But always be able to find something that you can celebrate, because there is always something that you can celebrate.
I love that, Lindsay. Celebrate all wins and just knowing that your journey is your own. But yet, even though it's your own, you do have a sense of community as well with Survivor. Anybody else who would like to go next?
I would say every phase is different. Every phase is going to require different energy. So just know that you got to give yourself some grace. And I personally, I would tell myself just 1 hour at a time. I couldn't even do the day at a time. It was just, let's just go 1 hour at a time. You just keep going and don't give up.
Yep, stay strong. Thank you, Juliana. Jocelyn, would you like to share?
I think it's always, you want to share a story, and I believe that everyone should share their story, no matter where they are in their journey, especially if you're diagnosed or end of diagnosis and you're in treatment or after treatment. No story is too small, and I think all of us should share our story, and that's one. And I think also the other is, as Juliana said and everyone said, if Claudia, I think we also need to understand our community as well. Really kind of focus in our community, because all our community is very different in their way that they accept this. And I think with API, because we kind of group everyone together, it's difficult. It's difficult to kind of break each of our stories apart and say, for me being Thai and Chinese, and also being, younger in the generation, I have a different story. But the key, and I think I was told, and Tamika reminded me, all of our stories are important, no matter what story it is, no matter where we are in our journey. Every story is important. It says something about us and everyone else, and people can connect to it, right? So no story is smaller than the other. Just because I had a hysterectomy doesn't mean my story is less important than someone that got chemo or radiation. Their story is as important as mine. And I think that's the key, is to share our story no matter what our story is, you know, and I have to remind myself sometimes that that is, we have to share our story in order so people can understand that we've all been through this, and we all have different, you know im- different issues, different things, even post treatment. And it's not just diagnosis and treatment, it's even post treatment that we're dealing with the side effects of cervical cancer. So I think that's the key, is that we continue to share our story no matter how we feel about it. It is important to share our story.
Thank you, Jocelyn. Thank you. Has everybody answered that question? I can't remember. All right. So I would like to just say thank you to everyone who was in the comments cheering us on. I would like to thank each and every one of our wonderful panel members. And thank you, Jocelyn, so much for co moderating and being a panelist as well. You had double duty tonight. And I appreciate all of you. I guess, like, to wrap things up, what I heard was that your journey is your own, but there is a sense of community. uh, Figure out how you can make connections within your community, tell your story, and give yourself grace through each little period. Take it day by day, hour by hour, however you need to. um, and thank you all so much for continuing to share your stories, and thank you all who joined us tonight. Thank you so much. You guys have a great night.